Hello, my name is Dr. Tanya Ghosh, and I'm an ophthalmologist who specializes in diseases of the retina. I've worked here in the heart of the Silicon Valley for over 25 years, and I'm at the Palo Alto Medical Foundation. I've developed a novel technique to treat central serous chorioretinopathy, or central serous retinopathy, through the use of breath exercises or breathwork, which I would like to share with you. I have found that this breathwork series works well not only in central serous, which is the shortened name, but it works for general well-being. It's quick, it's not intimidating, and it's quite effective. I'll start with discussing central serous before jumping into discussing the technique. The retina is the tissue all the way in the back of the eye that gathers light and sends the message to the brain. The center of the retina is called the macula, and that is the part of the retina that allows us to look at fine details such as reading a book, looking at numbers, discerning the details of someone's face, and the such. This macular vision is really important to us human beings. The rest of the retina is our side or peripheral vision. In central serous, a person may present with either sudden or gradual decrease and or distortion of central vision, usually in one eye. At times, the person may say that things in that eye just look smaller than the other eye. At times, the patient may have no symptoms, but that this is found by the eye doctor. This central serous is usually a blister of fluid in the macular area. Statistically, it tends to occur in young and middle-aged adults, men more commonly than women. It's been considered the CEO's disease, as the patients we ophthalmologists see are usually folks who are very intelligent, educated, and successful, but under lots of responsibility and stress. There may even be a familial tendency for this. The causes are not fully understood, but there are some well-known associations. One key association is a type A go-getter personality, or people who are revved up. Perhaps the person is in a very demanding position that then has a new additional burden of stress. There are some drugs that also have been implicated, such as corticosteroids, we call them steroids, not just by mouth and intravenous, but can be contained in some allergy medicines like nasal sprays, steroid creams. Other drugs can also predispose one to having an episode of central serous, such as stimulants, decongestants, erectile dysfunction medications. Some anti-cancer agents can trigger it also. This is why it's so important to tell your doctor about any and all medications and treatments that you are on. Patients with high blood pressure or heart disease and those in a current pregnancy have a higher risk too. What are the symptoms? This condition tends to more commonly affect one eye at a time. The person notes blurred central vision, which can come either quickly or slowly, which is what gets them to the eye doctor. The person might even see an asymmetry in vision sizes between the two eyes. The eye doctor will then do a comprehensive eye exam, especially zeroing in on studying the retina and then the center, which is the macula. There are variations. Most commonly, we might see a very obvious bump of fluid in the macular area. We might see additional bumps of fluid away from the central macula also. Sometimes previous bumps of fluid might leave a scar, so scars can be a sign of previous central serous. It can recur in the same eye, or it can go to the other eye at another episode. Thankfully, rarely does it occur in both eyes at the same time. What's the usual course of the disease? The person notes a distortion or loss of central vision clarity in one eye. They may have had a previous episode, or this may be the first episode. This usually resolves by itself within 3 months without any medical intervention. Most folks note improvement in a few weeks. The vision may go back fully to normal, or many patients may say that they are like 95% better with some residual irregularity. This may further improve with time. However, there are persons in whom the distortion stays longer and it's really affecting their work or general well-being by just being a tremendous bother. We doctors will of course start tackling the issue by asking if it's possible to stop any potential offending medications. We try to do this in conjunction with the doctor who prescribed the medication, as some drugs such as steroids might need to be stopped in a tapered fashion and not abruptly. Let's talk about how the condition is diagnosed. First, the eye doctor does a very comprehensive eye exam, focusing on the retina, usually by dilating the eyes and taking a thorough look at the cells and tissues of the retina. We use the OCT, which is the optical coherence tomography picture, to look at a cross-section of the retina at a very fine level. We're looking for bumps of fluid that are pretty typical of central serous, although there are cases that can be challenging as it can mimic other retinal diseases. In some cases, we might go on to do a test called the fluorescein angiogram. This is a test where fluorescein, which is a synthetic orange dye, is injected into your arm. Then regular camera pictures are taken with a special filter as the dye travels throughout the body and quickly gets to the retina, where we can see the cells of the retina at a very fine level to see if there's leakage in a spot, which is characteristic of central serous. This test can assure us of the appropriate diagnosis or help to distinguish it from other retinal diseases. Sometimes we can tell if central serous had occurred in the past by seeing if there are some scars, or we can see bumps of fluid that might indicate a chronic type of central serous. There are some caveats or side effects. It will definitely cause you to have bright orange urine for a day or two as it is rid from your body. It's usually a harmless procedure, but there are some cases of trouble. It can burn a bit if it gets into the skin instead of the vein. Some rare people can have nausea and vomiting during the test, usually lasting about 3 minutes. It's been reported in very rare cases to possibly cause shortness of breath, chest pain, fainting, and even death. We do have to inform you of this, even though it's extremely rare to have the terrible side effects as they've been reported in the literature. Again, this is called the fluorescein angiogram. Now let's discuss the treatments, starting with traditional methods for central serous. But then I will discuss the alternative treatment from which I've been getting truly astounding results, free of any bad side effects. Well, we usually start by patting you on the back, letting you know that this is caused by high stress and telling you to find ways to de-stress yourself. We ask you to come back in a month or so and ask how you're doing, and then look at that OCT to see if the fluid has changed. If that doesn't show any real progress, we have the option to proceed with 4 treatments. Number 1 is thermal laser or micropulse laser, where a really low power laser is applied to the area in hopes of resolution. Number 2 is we give oral medications such as spironolactone or eplerenone. Number 3 is injections of medicine into the eye. Number 4 is a particularly effective treatment of using cold laser, which is using photodynamic therapy with the drug verteporfin. With this photodynamic therapy, the drug verteporfin is injected into the arm and travels throughout the body. It makes the body very light sensitive to the point where you have to be out of direct sunshine for a few days or else you will get a severe sunburn. Now we harness the ability to make the tissues very light sensitive by then applying a very low dose of laser, the cold laser, to locally treat the leaking tissues which were found previously by that fluorescein angiogram. The painless treatment takes 83 seconds to complete. most folks have significant fluid resolution over the next month. The reason we don't jump to using photodynamic therapy with verteporfin is because it is a treatment. Again, in rare cases, while giving the infusion of verteporfin, the patient can get back pain. Good hydration usually prevents this. There's always the potential of an allergic reaction, chest pain, generalized fatigue. You do definitely have to be out of the sun for a few days. So if you go outside during daylight, you must be covered with a hat, sunglasses, long sleeves, pants, gloves, and even perhaps socks to prevent a sunburn. An umbrella can help. Sunblock is not enough. We usually put a band on your wrist should you end up in the hospital during the first few days after the procedure, so surgeons are aware that bright lights can burn you. The laser itself could possibly, albeit rarely, cause a retinal burn, thus defeating the goal of resolution from distortion. And truly, we can't forget this is an expensive procedure. What I'm now proposing is a completely different treatment and approach to central serous from the previously mentioned traditional treatments. Remember when I said this disease tends to occur in very successful, highly motivated individuals under high duress? It's known for decades in our field that stress is a major factor that leads to central serous. Well, I propose that we work at it from the angle of handling the overarching culprit, which is stress, anxiety, frustration, anger, and agitation. In that way, we're dealing with the root of the problem and not just symptomatically treating the eye. When we treat the cause, not only does the vision return, but the person feels better, sleeps better, thinks better. Even relationships smooth out a bit. What I propose is doing some simple breathwork exercises to break the anxiety and stress, decrease potential cortisol and other hormonal elevations, which then turn heals the central serous. I have demonstrated this time and again in the majority of my patients over the years, and it tends to work kind of like magic.